Reforming the nation's healthcare system is something that's long overdue. We can no longer afford the status quo of rising costs, uneven quality of care, and increasing number of uninsured, and the American people are demanding better.
In 2008, former Senate Majority Leaders George Mitchell, Howard Baker, Tom Daschle, and Bob Dole launched the Leaders Project, an unprecedented effort to address issues related to health care reform and ultimately provide solution-driven recommendations for reforming health care coverage and delivery in America.
Some things you can't agree on, but something that affects every American, something as important as health care, can't be addressed in a partisan way.
The Leaders Project on the state of American healthcare is one of 5 initiatives of the Bipartisan Policy Center. The BPC was formed to take on challenging issues outside the political arena, where partisanship and ideologies often impede progress. Instead, forums like these draw from a broad spectrum of key stakeholders and the unique perspectives they bring to the healthcare debate.
We are determined to demonstrate that it is possible to achieve bipartisan solutions to many of the major problems facing our country. And we all agree that our country can no longer afford the status quo in healthcare of rising costs, uneven quality of care, and increasing numbers of uninsured.
The fact that the BPC leadership chose healthcare reform as its signature project is hardly surprising. Nearly everyone would agree that the current healthcare system is severely flawed. Some would say broken, in fact. There's a recognition, too, that a new means of addressing the crisis is also sorely needed. Healthcare reform has been high on the national agenda for decades, but efforts to bring about genuine change have fallen far short of their visions. Most have failed altogether. What can we learn from these past experiences? And what can we bring to bear on our current efforts that will make a difference? In 1992, Democratic candidate Bill Clinton made health care reform a major campaign issue. Upon election as president, Clinton delivered on that campaign promise, sending to Congress a comprehensive plan to overhaul the U.S. healthcare system and guarantee universal coverage for all Americans. His ambitious goal was a serious departure from those of previous presidents. But from all appearances, the time for change seemed right. Public opinion polls showed that the American public wasn't just supporting a major overhaul of the healthcare system, but demanding it. There was also a growing consensus in the Republican-dominated Congress that the reform was needed. Even powerful organized interests such as the American Medical Association and Blue Cross Blue Shield, which had worked vigorously in the past to keep healthcare reform off the nation's policy agenda, now recognize that something needed to be done, especially toward the problems of the uninsured. President Clinton appointed a task force headed by First Lady Hillary Clinton to produce a bill that would restructure the nation's healthcare system. The result was the Health Security Act, which was based on the concept of managed competition. The core element of the proposed plan was an enforced mandate for employers to provide health insurance coverage to all of their employees through competitive but closely regulated health maintenance organizations. The Health Security Act was a hard political sell. Capitol Hill was badly split on the issue of health care reform. Not only were Democrats and Republicans at odds on what and how much should be done, but the parties within themselves were also divided. At least 5 alternatives to the administration's plans were offered up, ranging from the very liberal to the very conservative. Most Republicans adopted the strategy: oppose and defeat them all. As these various plans moved through different committees in the House and Senate during 1994, it became obvious that a comprehensive bill could not be passed. And indeed, not a single plan was voted on. By September 1994, the final compromise Democratic bill was declared dead by Senate Majority Leader George Mitchell. That November, voters told Congress what they thought of the administration's ambitious attempt to overhaul the nation's healthcare system. They gave control of both the House and Senate to Republicans for the first time in 40 years. It was now in the hands of a new Congress to decide on the direction of health care reform, if it chose to take up the issue at all. Republicans and their contract with America made health care reform a national priority once again. This time, however, there would be no call for sweeping reform. Change would be incremental. Even President Clinton agreed, urging Congress in his 1995 State of the Union address to do whatever it had to get something, anything done. In July 1995, a bipartisan health insurance bill was introduced in the Senate. The sponsors were Nancy Landon Kestenbaum, a Kansas Republican, and Edward Kennedy, a Massachusetts Democrat. The bill, known as Kennedy-Kestenbaum, was shrewdly crafted to capitalize on the few issues on which Democrats and Republicans were agreed, most especially the issue of portability. That is, making it easier for workers to move from job to job without risk of losing or being locked out of insurance. The bill also addressed the problems of Americans who have been excluded from coverage because of pre-existing conditions. It was a modest bill that addressed only a small portion of the population. Nevertheless, it represented a step in the right direction. In his State of the Union message in January 1996, President Clinton once again urged the Congress to act. That spring, however, when the bill was voted on in the House and the Senate, a major point of contention arose. The House bill contained a provision for medical savings accounts. The Senate version did not. The bill went to a conference committee to iron out the differences. Democrats were strongly opposed to MSAs, as they were called. The concern was that MSAs would be used primarily by the wealthy and the healthy to the disadvantage of the overall insurance system. President Clinton even threatened a veto if the provision was included. The battle of the conferees tied up the legislation for weeks. In the end, neither Republicans nor Democrats wanted to give up the chance for health care reform. A compromise on the Kennedy-Kestenbaum bill was reached. Medical savings accounts would be tried on an experimental basis. President Clinton signed the Health Insurance Portability and Accountability Act into law in August 1996. The signing ceremony was a bipartisan event. President Clinton celebrated the legislation as an example of what Democrats and Republicans could do when they put the nation's interest first. Perhaps that is the greatest lesson to be learned from the health care reform movement of the 1990s. The Kennedy-Kestenbaum bill fell far short of the sweeping reform that the Clinton administration had originally envisioned. But it represented a first step toward change and laid important groundwork for progress in the future.
What is different now that was not the case several years ago about why people want to talk about health care reform? Why is suddenly there's so much interest and engagement?
Today, the debate on health care reform continues.
Many are willing to discuss what's wrong with our healthcare system, but solutions have been more elusive. There is not going to be a technical fix to this problem. Solutions will be found only if we're willing to adopt a new paradigm into a new set of assumptions about health, individually and collectively.
Again, that is why we are starting today with this emphasis on quality, efficiency, and value, and getting better health at a lower cost as the first step in our BPC reform process.
Of course, our goal is to come up with solutions to those challenges that would be appealing to both Republicans and Democrats.
The players are many. Their priorities for change differ, and their remedies for fixing the nation's health care system.
There is no system. If there is a system, who designed it and who can we blame for it?
Is a matter of perspective. But it is the hope of the Leaders Project that through public forums like these, common ground can be found and policy solutions can be generated. As we have learned from our past efforts to address health care reform and other tough policy challenges, progress depends on the national will, a collective will of citizens and leadership that says, this is the time, this is the year to solve this problem.
we rarely have an opportunity to do something bigger than ourselves. It's very rare that the moment in time in political world or the environment comes about where we can make a contribution.